the definition of autoimmune is incorrect. It is not the body attacking itself. Protein never healed an autoimmune condition. It never healed pain. If you have an injury that has been lingering, we know there's something else going on. And that's what leads into some of this chronic pain syndrome. Basically, you've kept the inflammation in the area. Now it's just chronically inflamed. A lot of times you can manage it until something gets flared or the medication doesn't work. My name is Dr. Sherri Greene. After my medical training and surgical training, I came to New York City and I was there for about 29 years. I originally did my training in podiatric medicine and surgery. Early on in my career, I got also interested in natural medicine and alternative ways of healing. And I got really, really curious about helping people in another way outside of drugs and surgery. And so I started incorporating more and more of that into my practice as time went on. I started studying a lot of different healing modalities. I got into functional medicine. I got into nutritional medicine. I got into hands-on healing. I did a variety of different things. And I would bring all those tools back into my tool bag to help myself with patients that were difficult cases. And my practice really started to expand into working with lots of other types of conditions besides chronic pain, which I was working with a lot. Most recently working a lot with COVID and long COVID, which has been a big part of my practice as of 2020.
So there's still a lot of research to be done on COVID and long COVID, right? Is there anything that you're seeing now that maybe has not been published widely or maybe that a lot of people aren't aware of in helping treat patients with long COVID?
Yeah, there's lots of different symptoms that are happening with patients that get COVID or who've had more often vaccines and the vaccine injury piece that's coming up a lot for people. So, and there's a lot that's not making that connection right now, but I've been seeing that a lot in my practice because I ask a lot of questions of patients. So I'm seeing a lot of neurological conditions, a lot of joint pain, muscle pain, a lot of fatigue, some migraines, a whole host of crazy things that we're seeing, menstrual abnormalities, obviously a lot of heart issues. One of the things that people don't really understand, what happens is people get triggered. So if they get COVID or another infection, they actually trigger these low-grade viruses that they already have in their system. So what's happening is, and this is information that was put out originally by a gentleman by the name of Anthony William, and he talked about that we're getting reactivation of Epstein-Barr. So that's what I'm seeing a lot in my patients right now. That's really the biggest issue.
Interesting. Wow. It actually sounds a lot like a lot of autoimmune diseases. A lot of our readership, a lot of our subscribers and followers do have autoimmune conditions. So I want to ask, is there any coming back from an autoimmune disease diagnosis? Do you cure it or do you learn how to live with it?
So if you really go back and understand what the definition of autoimmune is, which is incorrect, it is not the body attacking itself. So if you look at it from the perspective that the body is attacking something, but it's not attacking self. So that is really foundational when it comes to autoimmune and understanding that the body's actually going after a pathogen that's already in your system. If you look at it from that perspective, if you look at whether it's lupus or MS or whatever the autoimmune condition or Hashimoto's thyroiditis, they're actually going after a pathogen that's in the body, not attacking the body self. So in that respect, you can actually recover and heal from autoimmune conditions. So that's a huge difference in medicine that's out there that leaves people to think they have to stay on, medication for the rest of their life. They have to learn how to manage it. But what they really need to do is clean up the body, detox, learn how to safely detox, and to be able to knock down the viral load. That's how you get better.
So when it comes to autoimmune conditions, have you seen that medications have been effective or more or less effective in just simple lifestyle changes and diet changes?
Well, what you're looking at when you use medications for these types of conditions, you're looking at a suppression of symptoms, right? So what you're looking at is a little bit of false sense, although obviously it's giving patients relief, whether they're dealing with Crohn's or whatever it is. It's a suppression of symptoms, but you're not fixing the root cause. So a lot of times you can manage it until something gets flared and it's not managed, or the medication doesn't work. And then medication dosages have to keep going up and up, or they have to add in another cocktail, another medication. But when you're working on the foundation of herbs and supplements and food as medicine, you're basically getting to the root cause. So if you're going to get to the root cause, you're going to work to heal, you're going to work to knock down symptoms, but in a much more permanent way, ultimately, because you're healing tissues, you're healing the body. The other way is just conventional medicine of suppressing symptoms. Now, there are times when we need to do that, so we don't throw it all out. They can be worked in conjunction as a bridge until that person gets to the place where they may be able to let go of the medications.
Wow, great answer. Okay, that's a great way to look at it. So as far as supplementation, have you seen any particular supplements work for any particular conditions, or are there any recommendations, let's say even for general health, that you say most people should take as far as supplements?
Well, I do think supplements are important because I don't feel we get enough of the nutrition or the value from enough from the food that we eat. And most people are not eating an abundance of fruits and vegetables. I look at diets every single day. I have people log their diets for me, and people think they're eating well or relatively well. And you see how many holes are in people's dietary plans because they are looking to, not be hungry. They end up taking things that are quick. They end up eating a lot of protein, a lot of fat. They're just not eating enough fruits and vegetables. And that's where you're really going to get your magic happening from there. Protein never healed an autoimmune condition. It never healed pain, but fruits and vegetables can do that. I believe that everybody needs a quality B12. I believe that everybody should take a quality zinc, and there's specific ones that I recommend. I believe that many people could use a B complex and some magnesium. Plant-based oils like EPA, DHA from plant-based, not fish-based, because the mercury levels are way too high. No matter what the company will tell you, there's still microdoses of mercury in fish oil. So I shy away from that and use plant-based sources. There's a lot of other supplements that I use, like antioxidants and, glutathione, but it really depends on who that person is and where their deficiencies are and what I'm looking to address. And it doesn't always mean that we're going to look at blood tests for that, because it's not really accurate to look at those types of markers in blood work. You really need to go by what that person is struggling with and symptoms and what their diet is like to really, and you can know intuitively what that person is more than likely going to need, because the blood test is a snapshot. It's what's circulating in the blood. It's not what's in the organ or the nervous tissue. So you have to look at it in a different approach.
Okay, great answers. Some things I had never heard of. The plant-based oils, that's new for me. That aside, is there any advice that you find yourself giving way too often to patients that just kind of fits the mold for you?
Sure. I mean, with my patients and creating this doctor-patient relationship, I don't really want to make people dependent on me forever. I want to teach them and I want to educate them. So I'm always looking to empower the patient to get educated so that they know what to do when this crisis happens or that crisis happens. I talk about food as medicine all the time. I talk about, healing is not, it's more of a marathon and it's not a sprint, and it's really about taking steps along the way. I talk a lot about preventative medicine because you're fine until you're not fine. And people are finding that out today. It's like, I was okay, and now I have this new diagnosis and I don't even know where that came from.
So when it comes to chronic pain, what are you seeing is the culprit most often? I know there are a few things that can cause such a thing, like you mentioned long COVID earlier. It could be injuries, sports injuries. So what are you seeing is causing the chronic pain or making it worse for people most often?
So obviously chronic pain is made worse from stress, and we all have an enormous amount of stress in our life. So when you raise adrenaline, when we're stressed all the time, it's going to exacerbate pain in the body. So that's learning how to help people stress reduce the, mindfulness and mind body connections and breathing and meditation, if that's something that person is interested in, but looking at where their stressors are in life and how to mitigate some of that. The other thing is that if you have an injury that has been lingering and it's not getting better in the timely fashion that the body would normally heal it, we know there's something else going on. And that's what leads into some of this chronic pain syndrome. So what I see in my practice is basically bringing it back again to these low grade viral, mostly herpetic viruses that actually produce what's called a neurotoxin, which attaches to the nerve. So when you've had an injury, let's say you've had an ankle sprain and it's chronic now, and you're always in this pain and you've done whatever you needed to do to get yourself to heal, but you're still in pain, more often than not, you have these little frayed fibers along the nerve that a neurotoxin then gets attached to that is coming from a virus. So basically you've kept the inflammation in the area. So it's not the original injury. Now it's just chronically inflamed. And what we need to look at is all these other low grade pathogens that people have. Now, the problem is you can't always test for all this because our system is a little bit antiquated and we can't test for all the mutations and all the different strains that are out there. So let's say that person has Epstein-Barr or has a variety of shingles or something like that that's not showing up on a blood test. It doesn't mean it's not there. It could mean that that's part of this. So when you work with herbs and you work with natural herbal antivirals and give the right supplements and the right diet, you can help that person to heal that injury. That's what used to be cute is chronic and has lasted, months and months and years for people.
Fascinating. Thank you for sharing that.
Sure.
Tell me about the Snug. What led you to start that group?
So that was a group that came from a little bit from my frustration of that I was only limited to working with people a certain amount of time in an office visit in a day, and that they needed so much more support. They needed a lot more mental, emotional support to go through the physical challenges that they were dealing with. So I brought in two colleagues of mine that are healers and shamans and also apply a lot of these teachings around food as medicine in their own lives and their own family. They're very powerful healers in their own right. And we got together to create what was called the Snug because one of the healers, Amy Jones, was from UK. And that is actually a term of a room that they use in the home where people gather and are comforted and kind of socialize together and just feel safe. It was like a safe space. So that was the idea, to come together once a month with the group of like their people, my patients, and have a little forum where we could speak about a topic, an emotional wellness topic, or talk about healing, or talk about the healing journey or discernment, all the things that are important for people to understand as they're going through their own healing journey and they're going through life, and helping them to heal on mind, body, spirit, soul levels. That's really why we all came together.
That is great. And is that still occurring? Can people find you if they want to?
So they can find me through my website, drsherrigreene.com. And currently we took a pause from the Snug, but we were kind of trying to revamp some things. August, I think, was our last one. And we're kind of in the works of figuring out what we want to do next and how we want to present that.
Great. So that leads right into my next question. Do you personally have any new health goals on the horizon?
Oh, I always feel like I always have health goals. I'm a big believer in movement and exercise. So I'm always looking to try and do something different to challenge myself. I think it's really important to move if you're able to. I mean, there are some people that are really, really chronically sick that can't do too much, but taking a walk is enough at times, just taking a short walk. I think one of my goals is more of a work-life balance because I feel like you can get really passionate about what you do and love what you do and just be working and working and working. And you need to stop and have some fun along the way. So I'm trying to balance that a little bit more in my own life right now.
Absolutely. Thank you so much. And is there anything else you'd like to share with us or our listeners?
I think one of the things that I always feel important in my practice to be able to empower my patients and inspire them, and really, really inspire them. It's easy to fall off the path, right? It's easy to get started on a healing journey or a lifestyle change, or, a good food plan, or you're taking out certain foods, and it's so easy to get to fall back and get off track. And so I love to inspire people that you can heal from anything. You really can. And so I think it's important to remember that and to have hope and faith as you go along this process.
You can heal from anything. Super inspiring. Thank you so much, Dr. Sherri Greene.
Pleasure.
I appreciate you for your time and your expertise. And that wraps our interview.
Thank you for inviting me. I appreciate it.